Okay, I'm back again. Something happened. I don't know. I have no idea what happened, but the video froze. Anyway, I'm Yvette, Lupus Wellness Coach, and I'm going to share this in my other group page. Okay. And I'm talking today about how lupus affects the cardiovascular system. Hey, Sarah, how are you? Thank you for joining in. Hey, Edwin, welcome back. We froze, so I had to jump off. Hey, what's up, D-Ski? What's going on? Hey, Carmel, thank you for joining in. So like I was saying, hey, Cindy, good to see you. Thank you for the hearts, dear. Thank you. It's so good to see you all. As you know, I had an issue with my heart, all due to lupus, really all due to stress. But I had the condition prior to this back in 2003, I want to say 2002, 2003, where the lupus attacked my heart. Hey, Sarah. And that caused me to have atherosclerosis. And I was fine for all these years, 17 years, and then all of a sudden, back in November 27th was the exact date, was when I had a heart attack. Hey, how are you, D-Ski? Thank God I was at the right place and at the right time, and I was able to get help, and they implanted a stent. It's actually my third stent. Yeah, it's my third stent. It's funny, I've been able to control the lupus for so many years, and I was able to heal my body, and now the lupus is fine, actually. They can't find it in my system. It's just there, quiet. I guess what you people would call remission. But they can't find anything, no activity, and even my tests come out clean of lupus. But it affected the heart. And now I have atherosclerosis. And this is what I'm going to talk about today, because even if you don't have lupus, heart disease is very huge in this country, is the #1 killer of men and women. And it's the #1 killer of people who have lupus as well. Most people think that it's kidney disease, and it's not. It's heart disease. So lupus can affect the cardiovascular system, and that includes the heart and the blood vessels. In fact, like I said, it's the #1 killer in people who have lupus, and even if you don't have lupus. So therefore, it's very important that you take steps to maintain, cardiovascular health. We all know not to smoke, since smoking can increase the risk of cardiovascular disease. A low cholesterol, low fat diet is also essential. Focus on eating whole grains. And if you're gluten-free, this is for my people who have autoimmune conditions out there, I would say start with the whole grains like amaranth, buckwheat, millet, wild rice, which I love, quinoa, and regular white rice. These are just to name a few. There are a lot more out there, and if you want to know, you can inbox me, or you could do a Google search and find out. Vegetables are very important. The leafy green vegetables, lean sources of protein. Also, limit your sodium intake. Like I said before, I take this. This is called Sea Seasonings Triple Blended Flakes. Is dulse, lava, and sea lettuce, and I use this instead of salt. And these are basically sea vegetables. They have the iodine in them, and I love it. I've been using this for years. Since I was in nutrition school, I started using this, and I love it. So just a little tip for you guys, and you can find that at your Whole Food store, Trader Joe's, or your local health food store. Anyway, so sodium levels are directly linked to blood pressure. Like I said, I like using the Dolphix. In addition, exercising is very important. And some people who have lupus or an autoimmune condition may have a problem with exercising because of joint pain, muscle pain, or fatigue and other symptoms. So engaging in low-impact daily activities such as walking, biking, yoga, which I used to do when I was first diagnosed with my conditions, also, Tai Chi and other forms of stretching may help to alleviate some of the pain, while also helping to maintain a healthy weight and strong cardiovascular system. And once you feel better, you can try other forms of exercise. I remember I started out with yoga, and eventually I worked my way up to working with weights. I was kickboxing before all this stuff happened in late November, and my plans are to go back to it in April once I get better. and I get the okay from my doctor to go back to weightlifting and the kickboxing. So 50% of people with lupus experience hypertension, which is high blood pressure, which is defined as hey Mandy, what's up, girl? Mwah, love you, my girl. How are you, my soul sister from another mister? So the blood pressure is greater than 140/90. In addition, the most common cause of high blood pressure in people with lupus is obesity. Hey Dominic, what's up, brother? How you doing? Long time no see. Happy New Year. Kidney disease and long-term steroid use. Other medications such as, I can't even pronounce this, cyclosporine is near-oral. Okay, that can also cause elevations in blood pressure. That's what for my people out there with lupus. Also, high blood pressure can lead to kidney failure, stroke, heart failure, and heart attack. So since cardiovascular disease is the #1 cause of death in people with lupus and in people who don't have lupus, remember that, in this country, it's very important that your blood pressure, your blood pressure is brought to a healthy 120/80 level and kept there. And there are things you could do for that. And I'll point out those as well. And I'm going to be doing another live chat about heart health. And my experience, and give some tips on that as well, but that's later on. Anyway, well, it's important that you take steps yourself to help achieve and maintain good cardiovascular health. Diet and exercise alone may not be enough to controlling your blood pressure. So therefore, your doctor may prescribe you medication for that to lower and control or maintain your blood pressure. Each medication works differently, and your doctor will work with you to elevate the prescription or to lower it depending on where you are, and which medication best suits your personal condition. So atherosclerosis, okay, which is what I was diagnosed with about 17 years ago when the lupus was active, is one of the things that you can get and be diagnosed with if you have lupus and the lupus happens to affect your heart. So atherosclerosis is the most common manifestation of cardiovascular disease in people with lupus and also in people who do not have lupus. The condition is caused by the accumulation of cholesterol and other substances known as plaque along the inner lining of the arterial walls. Okay, eventually this plaque can harden and restrict the flow of blood in various parts, of the artery, and in the body, including the heart and the brain. And if it ruptures, it can cause a clot to form, leading to complications like a heart attack, stroke. Research has shown that being overweight and having high blood pressure are the two most important predictors of heart disease in people who have lupus. In fact, the risk of heart attack in women with lupus at the age of 35 to 44 is 50 times greater than with women without lupus. And for everyone with lupus, the risk increases 7 to 9-fold. And also people who don't have lupus, run a risk of having cardiovascular disease. It's the #1 disease in this country, and cancer comes in second, believe it or not. Some people think cancer is #1, but it's actually #2. So even though lupus itself contributes to the development of atherosclerosis, traditional factors such as smoking, obesity, and high blood pressure can contribute to it. But these can be controlled, okay? Like I said before, with diet and lifestyle changes, and the doctor will give you medication if it can't be controlled with that either. But know that your genetic, the way your genetics are, you can control that as well, but you have to work hard, okay? And I'm going to talk about that later. I had my first attack in my late 30s due to lupus. So if you have to be vigilant and keep your eye on your heart health if you have lupus, because you don't want to end up having a problem. God forbid. I mean, it could be fatal. So The next thing I want to talk about is pericarditis, and is the most common heart problem associated with active lupus, and it occurs in about 25% of people with SLE. And the condition occurs when the pericardium, the thin membrane surrounding your heart, becomes swollen and irritated, and it's causing it to leak fluid around the heart. People with pericarditis may experience pressure pains that are worse lying down and better sitting up, and this condition is called pleurisy. You know, a lot of people with lupus have that, and it's funny because prior to me having my recent heart attack in November, I had a lot of my clients and a lot of people reach out to me through my YouTube page about pleurisy. Anyway, the condition is called pleurisy, and the pain hurts like hell, right? And people who have experienced know exactly what I am talking about. So often, non-steroid or steroids are effective in reducing the inflammation associated with this condition. My concern, okay, with this is that steroid medication can cause heart issues. So discuss it with your doctor and see what other natural things you can do, you know, diet-wise and stuff, to help contribute to reducing the inflammation in your body, because that's really important as well. Another condition you can get that's heart-related when you have lupus is called endocarditis, and that occurs in about 15% of people with lupus, and the condition leads to the development of growths called vegetations on the surface of the heart valves. So usually this form of endocarditis is associated with atherosclerosis. Oh, let me pronounce this correctly. Atherosclerosis lipid antibodies, which are present in 50% of people with SLE. I know my stuff, but I have problems pronouncing stuff sometimes, so I'm human. So endocarditis can lead to two major complications: infections and stroke. This is why I don't fix my videos, by the way. I want people to know that I am human, I'm normal, I'm not perfect, because none of us are perfect. We have imperfections, and you know, we are perfectly imperfect. And that's fine. So the vegetations are prime sites for bacterial growth, and an infected valve requires surgical replacement. Visits to the dentist offers opportunity, okay, for the bacteria to sneak into the blood and land in our heart valve. Therefore, people with severe heart murmurs should speak to their doctor about first taking an antibiotic before receiving dental work. In addition, pieces of that vegetation can break off and travel through the bloodstream and potentially create a blockage with the blood flow to the brain and causing a stroke, and we don't want that. If you have a heart vegetation, your doctor will prescribe anticoagulant medication to reduce the risk. You know, it'll help with the clogging of the blood to reduce the risk. The next one is myocarditis, and that's inflammation of the myocardium or heart muscle. And that occurs in fewer than 10% of people with lupus. People with this condition often experience a rapid heartbeat or chest pain, and X-ray may show an enlarged heart. So myocarditis may weaken your heart's ability to pump blood to the rest of your body. Therefore, it is a serious complication that must be closely monitored and treated with high doses of steroids for weeks or months. So if you suffer, my point is, if you suffer from lupus and feel you may have a heart condition, or if you don't even have lupus and you think you may have a heart condition, hello, primo, how are you, Jose Cruz? I recommend that you speak with your doctor and check with a cardiologist to check you. A heart attack or a stroke is very scary, and believe me, it can kill you. I was lucky on 2 occasions when it happened to me. And now I have the 3 stents, like I said. And it's due to lupus causing atherosclerosis in my body. In closing, I would like to recommend a book that a friend recommended to me called Dr. Dean Ornish' Program for Reversing Heart Disease. It's the only system scientifically proven to reverse heart disease without drugs or surgery. I'm reading this, folks. And this is really an excellent book. Dr. Ornish is a cardiologist in California. What I would like to share about this book is that it's not just based on the physical side of health, but also covers the psychological, emotional, and spiritual aspects that are vital to healing. And everyone who has seen me speak or has been my client knows how much, really knows how much I am, and I believe, hey Aaron, thank you for joining in, and I believe, and I base my practice on the physical, emotional, and spiritual aspects to healing, and how my clients have had success in reversing and controlling their symptoms. So now it's my turn again to step up to this challenge with my heart and reverse it like I did with lupus. I know my journey will not be easy, but I know it's not impossible. Others have done it. Now it's my turn, and I'm up for the challenge. I did it before with lupus, and I will do it with this, but this is an excellent book, and I really highly recommend it to all of you out there, whether you have lupus or not. But if you have a heart condition or know someone who has a heart condition, I highly recommend you get this book, and I'll post it underneath. So thank you for tuning in to my Lupus Live Chat. I ask that you share this with others if you feel that they can gain something from it. If you want more information about the lupus programs and other health programs that I offer, go to my website, which is YvetteLeBoy.com. You can also sign up for my newsletter. Follow me on social media. My business page here is Yvette LeBoy Lupus Wellness Coach or Yvette LeBoy Coach. My YouTube page is Yvette LeBoy Lupus Wellness Coach. On Twitter, I am Holistic Gal. On Instagram, I am One Holistic Diva. I am also creating a lupus recipe e-cookbook that will be available through my healing store. I will post that in February, so look out for that page to pop up on social media. And also thank you for tuning in today. I'm Yvette LeBoy from Yvette LeBoy Lupus Wellness Coach, where I really want you not to just survive, but I want you to thrive and be the best that you can be on all levels. I want you to be the fabulous diva and divo you were born to be. Thank you for joining me today. God bless, and I will see you next Sunday right here with my Lupus Live Chat. Take care. God bless.